Hi everyone, my name is Harriet Davidson. I am currently in sunny California, and the weather is nice and cool here with just a little bit of wind and breeze, but it's nice and cozy here. No snow and no rain. So currently, I am a registered nurse, predominantly case manager, but I've dabbled in a little bit of the registered nurse immunizer, making sure that all the folks around here have gotten their COVID vaccines and their boosters for those who would like to have that. And so we have kind of wrapped up that 5 month push on that with a major pharmacy chain. And now I'm currently accepting a position as a nurse or clinical educator, which I love to do. I love to be able to, share my knowledge of nursing skills and using particular, whether it's medical equipment or showing the nurses and the home health aides how to do a great job of taking care of their patients and specific nursing skills. I am also, my previous nursing experience is wide and varied. I have worked in psychiatric mental health as well. I have worked with children. I've worked in pediatrics, which I love to do also. And predominantly I've worked with the geriatric population, who is a favorite of mine. I love talking to the elderly. They're amazing, they're funny, and they have so much information to share. And they're smarter and wiser than we all, think. Okay? And also I've worked over in Hollywood, California, with Warner Brothers for quite a few years. I've met all the celebrities, including Ellen. Well, I don't want to name everybody, but pretty much all the people that, have shows there. I've met them. I've been the nurse to whenever there's a stunt and they need to have a nurse on standby. I've been on those locations. It's been fun. And so, yes, I've worked in the entertainment industry. They do have nurses there. It's called, I think, what is it called? Industrial or something like that. Nurse or set nurse. And so, yes, I've also taught. I've taught at Concord Career Colleges as a registered nurse instructor, where I provided instructions for the LVN students there. Why I chose to be a psychiatric mental health nurse practitioner is that I have become aware, and my patients and my friends have informed me that I disarm people. I allow them to relax. I'm not critical or judgmental, especially my children or my husband might not think so. Well, my daughter thinks so, but my husband, everybody has their own way. But certainly my friends and my patients believe that I disarm them and I allow them to be themselves, and I allow them to share their their life stories with me. And they also tend to believe that my advice has been pretty good. I've had patients tell me just talking to me has already made them feel better. So because of that, and also because I'm actually more comfortable in that way, though I can do pretty much, I can practice in any field of nursing. I believe that most importantly, my approach and making the patient feel comfortable and allowing the patient to share their information, what's going on with them, and that allows me to be a good healer, makes the psychiatric mental health nurse practitioner the kind of course or the kind of practice that I think suits me best ultimately. Why I considered enrolling in Purdue University to do this particular field of practice is because I've had success with Purdue in their bachelor program, and so far in the Masters of Nursing to PMHNP program. The school and its curriculum and its routine kind of, pretty much the way their classes or the program works generally suits my my tempo, or generally suits my routine. So it works well for me. My career goals ultimately is to continue to complete this program and to take my state boards as a psychiatric mental health nurse practitioner, to pass those state boards, and to I might just work with a group of doctors at first in that field, but eventually I do want to have my own practice. California allows that after 3 years of being supervised by a senior psychiatrist or physician in that area, or even a practitioner, nurse practitioner in that area, that I can have my own practice after 3 years. And so ultimately that's my own goal within the next 3 years. Pretty much that's my introduction. Okay, thank you so much.